In health news, heart valve replacement is typically an open heart procedure. However, for some patients, that surgery can just be too risky. Tonight, News 4's Dr. Peter Ostro shows us a less invasive fix and introduces us to one man who's gone through it.
Hello, Parker Pharmacy.
Larry Rosen is a pharmacist. He's still working at age 81, but a couple of years ago, he had heart failure due to a problem with his aortic valve.
Well, you ran out of breath quickly. You couldn't really walk very far.
You can see his valve on this scan. It's bright white because it's calcified and rigid. He'd had previous heart surgery, so surgeons were reluctant to take a chance on another operation.
Oftentimes, they are denied this procedure or they're turned down because of a high mortality risk. And the result is that they don't get a treatment.
But Dr. Iyer and his colleagues at Gates Vascular Institute were working on a technique to replace the valve without surgery. Larry was one of their first patients. The valve they use is attached to a metal mesh, just like the stents used in coronary arteries. It's compressed onto a catheter and then threaded through the arteries into the position of the damaged valve. Here you can see the valve being opened, replacing the damaged original valve. They've done it for 78 high-risk patients with remarkable results.
It improves survival even in this elderly group of patients who had significant medical comorbidities. Second, and probably more importantly, it significantly improved their quality of life. They had less symptoms of heart failure. They were less likely to get readmitted to the hospital for symptoms related to their heart.
Larry is living proof of that success.
I went back to work with no problem whatsoever and just functioning normally. I'd do shopping, laundry, chores, whatever, just like I was 20 years ago.
Now, without that procedure, it's not likely he'd be alive today.
My gosh.
You know, there's lots of people in similar situations with heart failure due to a damaged valve and then other problems that make surgery too risky for them. They should be aware, and their physicians should be aware, that now there are some good alternatives. This is a very good alternative.
Absolutely. Talk to your doctor. But I got to ask you, open heart surgery, major surgery. This, is definitely less invasive. What about recovery time?
Well, recovery is faster also. With both of those procedures, you would spend about 5 days in the hospital. But after that, recovery from an open heart procedure takes 2 to 4 months, where for the catheter, it's about 2 to 4 weeks. In fact, Larry was back at work a few days after he was discharged from the hospital.
That is amazing.
Yeah.
Thank you, Dr. Ostro.